There are few activities as simple, accessible, and universally beneficial as walking. It requires no gym membership, no complicated equipment, and no special training, just a pair of shoes and the willingness to move. And yet, despite its simplicity, walking is one of the most powerful tools we have to support physical, mental, and emotional well-being. It has long been associated with improved heart health, reduced joint pain, enhanced mood, and even a greater sense of calm and mental clarity. Now, a growing body of research is adding further depth to our understanding of walking's benefits, and one variation in particular, Nordic walking, is emerging as a remarkable option for individuals looking to maximize the return on their time and effort. Nordic walking takes the foundational movements of regular walking and elevates them by incorporating the use of specially designed poles. This movement style activates not only the lower body muscles but also engages the upper body, including the arms, shoulders, and back. That full body integration turns a simple walk into a much more dynamic, cardiovascularly demanding activity without feeling excessively strenuous. Originally developed in the mid-20th century as an off-season conditioning workout for cross-country skiers, Nordic walking has evolved into a fitness modality with powerful implications for everyday health, and not just among elite athletes or outdoor enthusiasts. The results of a recent study published in the Canadian Journal of Cardiology bring exciting confirmation of what many in the fitness and rehabilitation communities have suspected for years. Nordic walking is more than just a variation of a stroll with poles. It's a game changer, especially for those with coronary artery disease, CAD, the most common type of heart disease in the United States. The study followed 130 individuals with CAD over a 12-week period, comparing the outcomes of 3 different exercise regimens: high-intensity interval training, HIIT, moderate to vigorous continuous training, and Nordic walking. All groups saw improvements, but those who practiced Nordic walking showed the greatest gains in functional capacity, measured by how far they could walk in 6 minutes. This is a meaningful metric because it reflects the real-world ability of someone to perform daily activities and engage with life. For those living with or recovering from heart conditions, this improved capacity could mean the difference between independence and reliance, vitality and frailty. But the benefits didn't stop there. Participants also reported improvements in mood and well-being as measured by validated questionnaires, including the Beck Depression Inventory. This is a crucial finding, as mental health and physical health are deeply intertwined, especially for individuals with chronic illnesses. The act of engaging more of the body during exercise, combined with the rhythmic and grounding nature of walking, can provide psychological relief, ease symptoms of anxiety and depression, and foster a stronger sense of agency over one's health. Why is Nordic walking so effective? Much of it comes down to its ability to combine efficiency with low impact. By involving the upper and lower body simultaneously, Nordic walking increases heart rate more than regular walking, but without significantly increasing the perceived effort or strain on joints. This makes it particularly well-suited for people recovering from illness or injury, older adults, and anyone who may be intimidated by more vigorous forms of exercise. It's also highly adaptable, suitable for city sidewalks, rural paths, or mountain trails. It's not reserved for athletes or hikers. It's an accessible practice for anyone who wants to improve their cardiovascular health, strength, posture, and balance, all in one movement. What's even more encouraging is that this form of exercise doesn't demand massive time commitments. Just 150 minutes per week, about 30 minutes a day, 5 days a week, of moderate intensity movement like Nordic walking meets the American Heart Association's minimum recommendations for aerobic exercise. And for those who go beyond that baseline, studies suggest even greater benefits in terms of longevity, disease prevention, and overall quality of life. It's a scalable practice. A few minutes today can build into a lifelong habit that offers compounding returns. There is something uniquely joyful and empowering about walking, especially when it becomes more than just a means of getting from one place to another. Nordic walking transforms a walk into a mindful, full-body experience. It encourages upright posture, engages core stability, and cultivates coordination. The act of planting the poles and pushing off with each step can bring a sense of rhythm and flow, enhancing the mental clarity and stress relief that already come with walking. And because it's easy to learn and low risk, people of all ages and fitness levels can take part. It creates an opportunity to be in nature, to breathe deeply, to engage the senses, and to reconnect with the body in a meaningful way. Nordic walking is a reminder that health doesn't have to come from punishing routines or expensive interventions. Sometimes it can come from simply stepping outside with a pair of poles and moving forward, literally and metaphorically. It's a celebration of simplicity meeting science, of movement meeting purpose. And for those with coronary artery disease or anyone simply hoping to live with more vitality, it offers a path to improved health that is both effective and profoundly accessible.